Okay. So, this is now exercise number 2 for a special dentures technique. On this case, as we talk about in class, Miss Leila Saints will be getting a new immediate complete denture on the upper arch. As we know, as we have learned throughout the dentures course, the first thing we do is, we do the initial evaluation, we do the medical evaluation, and we get to know the patient first, right? And in that same appointment, clinical appointment, we're gonna take some records, some alginate preliminary impressions. With the alginate preliminary impressions, we're getting a set of diagnostic casts, okay? Now, I've seen you guys taking some good diagnostic casts, and I need to bring these back again. You guys need to, do a better job on the on the pouring and trimming this cast. So now here we are with Miss Leila Saints. For now, we're gonna focus on the upper arch. And on the upper arch, what I want to do now, as we have spoken on the immediate dentures, the immediate dentures, what's gonna happen with this patient is we have this impression. Then with this one, I'm gonna fabricate a custom impression tray. This custom impression tray will help me to take the final impression. That final impression will still have the teeth. We're still having the patient with teeth. I'm gonna do some base plates and wax rims so I can bring the relationship between the upper and the lower, that means the MMR records, and transfer that onto the semi-adjustable articulator, right? And then once I have that, I can start performing the extractions of the teeth, maintaining that vertical dimension, and I can fabricate a complete immediate denture before I perform the extractions on Miss
Actually
Saints.
on the patient, but we're extracting the teeth, so to speak, from the cast.
From the cast.
Ahead of time, right.
Yeah.
And you have 2 techniques we're going to teach you on that.
Exactly.
Derbies and reference line.
The first thing is first, what I want to do, and this is on your project, what we're doing is I'm going to mark where, remember, the denture limits. And the denture limits would be, where's the denture limits, guys? Dr. Van?
The depth of the vestibule.
The depth of the vestibule. And this is not the deepest part of the vestibule, right? It's the functional, or in this case, it is the deepest because it's not a functional impression. We took this with alginate. That means that this is not the deepest, this is the deepest part of the vestibule, because what happened with the alginate?
Overextended.
It will get me an overextended impression, because the density of the alginate will displace the tissues and give me an overextended impression. Anyways, so now that we have that, I'm gonna go ahead and now draw a line about 3 to 4 millimeters above. And remember, guys, this is just impression trace. This is not heart surgery yet. What do you mean yet, Dr. Van?
With you, there's no telling. You're sewing up fingers and all kinds of things, and I'm telling what you'll try next.
So, this is just, what I'm doing here is I'm tracing where do I want
the tray to end, yeah.
The tray to end. So that way, right?
And we're using the darker color here so we can see it through the wax he's going to apply in a little bit. And we're able to mark the wax.
You see it well?
Tip it towards me a little bit. There you go. Yeah, a little bit more so I can see. There you go.
Good. Okay, so now we have these. What's the next step? You guys remember? We're going to create some spacing.
Here we're going to use just good old soft wax. We don't need the extra hard wax. And it's usually a little more translucent so we can see that line through it.
Right. So make sure, if you don't have a strong color, you can even use a Sharpie or,
Good old black pencil.
or a black pencil or something like that. I'm gonna paint it a little bit more, just to have it nice, just to show it on the video where this should go. Right? Now, in the meantime, and you're wondering, well, how am I going to do a final impression of this patient? And remember, guys, when we're talking about immediate dentures, many times, like I have said, many times these patients are on the terminal, on the, how do you say the term? Terminal dentition?
Terminal dentition, yes.
They're on the
Like a train terminal.
like
the end of the line.
On the terminal dentition. So if they are on the terminal dentition, the teeth may be mobile, may be periodontally compromised. So we need some wax relief, and I will show you, and we will show you how do we do the final impressions of these cases. The first thing we need to do is we need to get my wax all the way to where I need it. I made a little mess here, Dr. Van, but I think we're gonna get it.
It's part of removable prosthodontics. We're messy.
If we're not messy, we're not removable, right? Just doing one small coat. I can always go into the flame or get your torch to get this wax in the right temperature again. And basically what I'm looking for here is just to get an even spacing all the way down. Again, like we always say, there's so many ways to kill the fly, right? There's 1,000 ways to kill the fly. What I need you guys to know is what is it that you're looking for. And that's exactly what it matters here. So what it matters is that you understand that you need to have a custom impression tray that will get far enough down to where you can border mold this and fabricate a nice and precise impression to get the most accurate model or cast possible. I'm going to carve D. Okay, so once I have this, what am I missing?
Well, you got to have tissue stops.
Yeah, thank you.
But here, since we're going to cut out the window, yeah, we need some on the tissue.
We need some on the tissue.
Make them fairly big, 4 by 4 or so, 4 millimeters by 4 millimeters. So it doesn't sink into the tissue as bad.
Right.
And distort the tissue.
Probably in this case, because the teeth will be off, right, Wally? Do we want to make another one somewhere?
Good one right behind your cuspid and your bicuspid if you want. So, although that one's kind of middle between the tuberosity in there.
You'll see the difference between this impression tray and the other one.
No,
So once we have this,
now you're going to do that indentation in the wax over the dark line, or not? Which is where you're going to want to cut the tray when it's cured.
so this case, as Dr. Van was mentioning, what we're doing is, you see how the wax went all the way down to the deepest part of the vestibule, right? But my blue line right here, I'm trying to strike like a little, how do you say this? Like a little
Indentation.
indentation.
You're carving a line, and on the tray material, it's going to be a raised bead because it's going to go into that indentation.
Right.
And you cut the tray back to that raised bead, then take the bead off, and that's the extent of your tray, and it's got relief all the way to the end of the flange.
Right? So that way, this is just another way, don't get confused. This is just another way of doing it. And the only thing, again, guys, the only difference about this, the tray is gonna be short. The tray needs to be, not needs to be touching all the deepest part of this vestibule, okay? It does not have to be all the way down there. It has to be to where can you see it there, Wallace?
Tilt it down toward me some more. Here, okay. I think we can see it. Yeah, I can see the dark line, so. Yeah.
Yes. Right there. Keep the zoom in. I'm just gonna zoom out to make sure we're showing
Tissue stops.
tissue stops. This is also gonna work as a tissue stop.
Yes. Posterior palatal seal.
Posterior palatal seal. And this is the first step. Now, after this, what's next? I'm gonna do a little, I don't need that much Vaseline, but on the cast portion of it,
The exposed stone.
the
Yes.
exposed stone, we can always put a little bit of Vaseline right here. You don't put it in the wax, because the wax do not need any Vaseline. So don't put it on the wax, just to make sure we get it in there. Once I have that, okay, we're ready to do some
Yep.
custom tray material.